My name is Lisa DeMarsico, and I'm the Assistant Director of Graduate Programs here at the College of New Jersey. And tonight we do have our virtual open house for our advanced nursing program. So just to give you a rundown of what the webinar will include tonight, you'll have two presenters. Dr. Connie Kartos will be presenting on behalf of the Department of Nursing. She'll be providing you with information about the programs. And then I myself will be presenting. Again, I'm the Assistant Director of Graduate Programs, and I'll be talking a little bit about graduate admissions. And if you want to take a screenshot of our contact information here for any follow-up questions you might have, now's a good time to take that. Email, phone numbers, websites, Facebook pages, etc. Give you a second to do that. So what will we be covering tonight? Dr. Kartos will be covering programs available, admission from a program perspective, and why you might want to consider TCNJ for nursing. And then I'll be covering the graduate admissions and application process, and then graduate assistantship opportunities here at TCNJ. And then we'll go into our Q&A session. But as Robbie mentioned, please start asking your questions while we're presenting. As a question comes up, definitely write it into that question or chat box so that when we go to our Q&A session, we already have some questions slotted. And that'll be a panel with Dr. Kartos and myself where hopefully we'll be able to answer both your programmatic questions as well as your questions on the admissions process. And as Robbie said again, anything that we either don't get to tonight or if it's something that we need to follow up with you on, we will have all your questions logged so that we can reach out to you after the webinar is over. And without further ado, I'm going to hand it over to Dr. Kartos so that she can start talking to you about the programs that we do have here at TCNJ for graduate nursing. And I'm just going to throw the screen over to her.
Great. So good evening, everybody, and welcome to this online webinar. This is actually the first time that we've chosen to do an online webinar to answer people's questions. So I have two great people backing me up with technology, but as always, just asking for potential forgiveness in advance. But it looks like I've got I believe at least my initial slide here and up and running. So I can't emphasize enough what Lisa said. Please type in questions as they occur to you. We want to be able to answer your questions, so don't hesitate. Don't feel like you need to wait until we're done or anything like that. It's really more informal, and we want to make sure that we answer your particular questions for your particular scenarios if we at all possibly can. So my job, as Lisa said, is to tell you a little bit about our graduate nursing programs here and to give you an idea of what it might be like to pursue a master's degree with us at TCNJ Nursing. So what we have available is down at the bottom you see some pictures of all kinds of folks who are saying I am an NP, and certainly nurse practitioners are sort of the it profession. This year I think we're the #1 or #2 profession in the country as far as salary, livability, job satisfaction, enjoyment, and all those things. We have additional programs as well, but I'll start just by outlining the nurse practitioner programs. We have our tracks that we have for those of you who are interested in being a nurse practitioner. We have a family nurse practitioner track and an adult gerontology nurse practitioner track that are housed 100% here at the College of New Jersey. We also have a neonatal nurse practitioner program, which is a joint program with Thomas Jefferson. And so those students start with us and do what we call the core of a master's degree in nursing, and then transfer down to Thomas Jefferson to do their clinical experience, and then return to us in sort of the final semester to sort of do a wrap-up with us. So we have a really nice joint program there, and we do have people who, we do have one student currently in that program. We also have a CNL, or a Clinical Nurse Leader program. For those of you who are not familiar, clinical nurse leaders are individuals with master's degrees who work typically in tertiary care facilities in hospitals, sometimes in large programs where they might be in oncology centers, and they're sort of nursing leaders, and our education prepares you to take the clinical nurse leader certification exam, and once you have that role, you are providing leadership for registered nurses on a floor. You may be driving changes in care. You may be doing changing programs based on cost effectiveness, and really helping change the way units or hospital systems or even outpatient systems function. You're not licensed to be a nurse practitioner, but it's definitely a leadership role within nursing and in demand because clinical nurse leaders are prepared to look at cost benefits of care. And so some of the graduates we have from our program have been able to save their institutions significant in tens of thousands of dollars worth of money. So but definitely you're sort of paying your own salary by analyzing that kind of data. So we prepare students to do that. We also have a school nurse certificate and a school nurse master's program that we have had for a long time and has sort of been on hiatus. We are starting that up again this fall, so we're accepting applicants for that program. School nurse certificate is going to be sort of a layered program. You can come and get a school nurse certificate without the instructional component, but we do not encourage people to do that. It makes it much messier if you need to come back later to get the certificate for instructional. And many school districts, many jobs want nurses who are prepared to teach a health class. Then for those students who want to get the certificate, get out, get some work experience, all of those credits can apply later to a master's degree in school nursing. So you have kind of a long time to be able to come back if you want to get going, but you don't want to finish your master's degree at this juncture. We also have post-master's certificates for family nurse practitioners and adult gerontology nurse practitioners. So for example, we had one graduate of our CNL program who went through and was functioning as a CNL, but then wanted to be able to be licensed as a nurse practitioner. So she came back for a post-master's certificate, just taking those very clear-cut clinical courses that taught her how to be a nurse practitioner. Sometimes we have students who have gone through an adult gerontology program. They didn't want the family nurse practitioner component, so they didn't get the education to take care of children or pregnant women. And we have a post-master certificate for that. It's very quick. It's 3 courses, and you have your hours, and then you can sit for the family nurse practitioner exam as well. So that kind of gives you an idea of the programs that we offer here. So the next thing is, okay, you want to do that. What do you need to get in? As far as nursing specific, Lisa's going to talk a little bit more specifically about what TCNJ is going to require you to do. But here in the Department of Nursing, to get a master's degree, you're going to need a bachelor's degree in nursing. We are refining a bridge program, which is RN to MSN. Our acceptances for that are on hold right now. We hope to have that program clear and running in the fall, but right now we're taking applications, but we're not answering those applications because we have some procedural pieces as far as fees and lining up, making sure we have all the course requirements in order. We're approved for it, but we just have a couple more procedural things. So at this juncture, for our master's degree, you're going to need a BSN. You need a statistics course within the past 5 years. That doesn't have to be a graduate level statistics course. It needs to be an undergraduate statistics course. It can be from anywhere. It can be community college. If you're an online learner and you want to do that online, it can, but it needs to be within the past 5 years. The nursing research that you'll be reading here as a graduate student really is going to require that your statistical knowledge is somewhat recent. You need the GREs, or you can have the GREs waived, and Lisa will correct me if I'm wrong, but if your undergraduate GPA was a 3.2 or better, generally we will waive the GREs. The only time that we don't do that is occasionally we have students who got their degree overseas in a program that we're very unfamiliar with, in a program that we know maybe wasn't rigorous, or if there's a question about references that you submit and you're maybe more questionable and we're not sure that you're really going to be the kind of candidate that's going to succeed in our program, we may ask you to do the GREs. And if your GPA undergrad was under 3.2, we're going to want to see those scores. And I think Those scores we can use to really help predict if you're going to succeed in the program. You're going to invest a lot of time and energy and money to do this, and we want to make sure from the get-go that we believe that you're a candidate that's going to get all the way through. So that's why that's there. If you have questions about that, you can certainly reach out to Lisa or I on an individual basis to find out. You do need an undergraduate health assessment course or a waived equivalent. And this, again, some people never had a specific health assessment course. I have some applicants who had it embedded in a medical surgical course or something like that. That's something that if you didn't have it, you could individually ask myself, send me an email and say, this is how I got my health assessment skill set. But as a nurse practitioner particularly, and even as a CNL, you're going to utilize those health assessment skills over and over again. And our advanced health assessment course really hits the ground running, and we expect that you are going to have a broad-based understanding of how to do a full history, not just a focused medical history that you're asking, do you have chest pain, do you have trouble breathing? We really want that ability. So if you have questions, you're going to talk to us about that, but we'd like to see an undergraduate health assessment course. And you do need to apply. Lisa's going to talk about those details, and she'll help you figure out how to get that done. I think we have a nice, clean online system, and Lisa can walk you through that. Possibly we'll have an interview, I would say, for most of our students that apply. They have some kind of question that I end up on the phone with them at some point. Some people want to come in and see the campus. We're happy to do that for you. Some people just want to come in and meet us because they get a sense of who we are, and we're happy to do that as well. Don't be worried. Sometimes we just think it's easier to reach out and get an interview because there's issues about what's going to transfer in, if you have things that you want to transfer, or we're not quite sure that we understand what you want to do with the degree. So it's not a bad thing if we call you in to interview. Sometimes it's just because we want to meet you. So that's what you need to do to get in. Once you're in and you've decided that this is definitely the choice for you, this is sort of some key pieces to what our program kind of looks like. So we generally run with evening classes that are face-to-face at this point. Classes run Monday through Thursday. We don't have Friday night classes, and at this juncture we don't have Saturday or Sunday classes. So classes typically start at about 5 o'clock. Some classes start at 6 and run for 3 or 4 hours. Typically students choose to take a part-time track, which allows them, as you see next, to take classes, usually 2 classes a semester. So in that, you're usually here 2 nights a week, sometimes 1 night a week, where we may have adjusted classes to go back to back, but typically you're here 1 or 2 nights a week. If you are a full-time student and you are in a hurry because you just want to get this done and you have maybe a great job waiting for you, or an employer who's funding you and says, get this done, get to be a nurse practitioner, or get to be a CNL, and I've got this great position for you, that full-time study, you're going to be taking 3 classes per semester, and that is going to require you to be on campus 2 and possibly 3 nights a week. Again, part-time, there are some times, depending on your program of study, where you may only be taking 1 class, or typically it's going to be 2 evenings a week. As far as whether or not we go in the summer, in the first summer of part-time study, you would be off, so you would have that full summer off. Our school nurse programs are a little bit different. We run those kind of through the summer because that's typically if people are trying to do that and then maybe substitute school nurse. We know that there's more time in the summer, so those students we do run in the summer. Our full-time students, it's going to be 2 calendar years. You're going to start at the end of August and you're going to be done in August 2 years later, so you don't get that first summer off. But part-time students, basically it'll take you 3 years, and that first summer you're going to get to go enjoy and have some downtime and try to absorb the learning that you've had. So typically, what does the master's program here look like? Hopefully most of you have gone to our website where you can see courses of study. You can also go to the graduate bulletin, which you can find on our website. Open up that graduate bulletin, and then you can scroll all the way through the nursing programs, and you'll see the courses listed there. Basically, any master's degree in nursing in the United States, any certified program is going to offer what we call the master's core, or the 3 Ps, physiology, pharmacology, and physical assessment at the advanced level. So students typically start with advanced pathophysiology. That's a course that I teach here. I've been teaching that on and off for several years. And we try to dig as deep as we can into the literature to really understand current pathophysiology knowledge and tie that to clinical pieces. That is usually paired with some nursing role and nursing theory courses in your first semester, and then in the spring we go right to pharmacology, advanced pharmacology. For our nurse practitioner students, we really focus particularly on having attention to what it means to be able to prescribe those drugs, because as nurse practitioners you're going to learn to prescribe. For our CNL students, we try to help them focus a little bit on cost-benefit, implications for delivery, things like that. And then if you're a full-time student, you'll jump right into physical assessment, advanced physical assessment. If you're a part-time student, you'll typically wait a whole year before you take advanced physical assessment. And that is where we do full head-to-toe and full history. We do gynecologic exams and male genital exams with standardized patients. And we also, you'll see in the next slide, we do some online virtual experiences as well there. So that's going to be the core. Surrounding that, once you get through the core, you start a clinical core series. So for our nurse practitioners, that's going to be combined with 180 for our adult GERO students, or 200 hours of clinical per semester. It's about 1 to 2 hours a week. We run in 15 to 16-week semesters. I'm sorry, 1 to 2 days a week where you'll be in a clinical setting, and then 1 evening a week you will be in class going over what that care is. Our clinical nurse leader program is slightly different, where those students will do 1 semester of 500 clinical hours. So it is very time intensive. You'll be paired with a clinical nurse leader, and you'll be doing projects for a healthcare system, whether that's inpatient or outpatient, and we'll help you identify those settings. For our nurse practitioner students, we try to rotate to give you a broad exposure. We have a lot of settings in student health. We have some nursing home placements, assisted living places, primary care placements. For our family nurse practitioners, pediatric placements. Sometimes we do inpatient, although we are a primary care nurse practitioner program. We do have some inpatient rotations. Finally, in our last semester, we will offer students an opportunity to specialize with a 50-hour clinical specialization, and we have colleagues that precept for us, for example, in ear, nose, and throat, infectious disease, dermatology, so people are able to kind of pick something that they might be interested in. And then the other major component of a master's degree in nursing and a component of a master's degree here at TCNJ is going to be what we call capstone experience. This isn't a master's thesis, so I don't want anybody to panic, but it's going to be a cumulative experience that sort of ties together all of your learning. The core 3 Ps, the clinical experience, as well as knowledge about nursing research. You're not going to, in this experience, you're not going to create nursing research, but we more see this as an evidence-based practice project. So you might say, look, I know what the nursing research said is the ideal treatment here, or the ideal pathway for these patients in this setting, and I'm going to see if it works in this particular setting. So we do that over the course of the program, and that culminates, you'll see, in a poster session where students will present that work. And we do have students who publish that work as well. So that's kind of the core of any nurse practitioner program, but why might you want to consider our program? So some of the things that I'm particularly proud of and excited here to be offering at the master's program is we have what is becoming increasingly unique in that we have personalized face-to-face instruction. Many master's programs are online, and that works very well for some people, but some of us don't particularly learn best in an online environment. And so we are a face-to-face program. You will come to class. You will interact with us as professors and colleagues, and we will work through your learning together. We have typically small class sizes. Our advanced pathophysiology class ranges from about 15 to 21, and that's going to be the biggest class because that's our entry-level class. And typically down in the clinical courses, you're going to be looking at 6 to 10 students. So a lot of individualized attention where you can get your questions answered in an easy environment to do that. Again, something else I'm particularly proud of is that all of our students who've graduated from our programs, either CNL or nurse practitioner, we have a 100% board pass rate. Nurse practitioners in New Jersey to be licensed, and any advanced practice nurse to be licensed in New Jersey, you need to pass a certifying exam. So it's not an NCLEX board, but it is a certification exam. And last year we had a 100% pass rate, but we have not had a fail in my experience here at TCNJ. So I think that's remarkable. And for me, that comes from the ability that we have to provide in-depth, detailed, face-to-face instruction and to work with students at an individualist level. Again, the capstone experience, which goes through several nursing research, nursing theory courses, provides you with an opportunity to produce something that can be published, and that particularly leads for those of you who don't see the master's degree as the end of your education. That will be something that you can use as a foundation to apply to a doctoral program in nursing. So I think that we have a great way, and definitely our students are prepared. We see it definitely as our role to prepare students who wish to go on to doctoral study to be able to do that with the products of that capstone experience. Something else that we do here that's kind of nice is we actually clinically place students. We do not require you to have a clinical placement coming into our program. You're certainly welcome to go get a clinical placement, and we'll work with you to do that, but we do provide clinical placements for students. And not all programs will do that. So we're happy to be able to continue to do that. We've recently written some grant proposals at the federal level to be able to do that at a very large level. Finally, in addition, we have an articulation agreement with the Rutgers DNP program, which is the Doctor of Nursing Practice program, so that for those of you who want to go on to doctoral study, we have the ability to have a streamlined process with Rutgers. You do have to apply to that program, but they understand the rigor of our program here, and they will take some credit for some of the classes you have here. So that streamlines if you choose to go on to do a DNP in the future. And we continually work with Rutgers to make that a better, more seamless progression as well. Some of the things that we're working on here, so where are we headed with our master's program? We are working on some hybrid class experiences. An example of that is our Shadow Health program that we utilize in health assessment. You'll see the screenshot here down in this slide. This is a program called Shadow Health. It's a virtual reality program, so in health assessment you'll be assigned, this becomes like a textbook, and you will be able to go in and ask a virtual patient what their symptoms they have and get the answers, be able to create a beginning diagnosis for that patient or plan of care. You can look in ears, you can listen to lung sounds, heart sounds, and get feedback. So that's sort of an exciting piece that we're layering in. The other thing that hybrid class experiences, we know as much as we're happy with our face-to-face instruction, and we think that works for many people, we know people are busy. So we are working on ways to utilize the best of technology when we need to. So if there are experiences that we find that are online experiences, we assign, sometimes there's a class that's replaced by an online experience, but that's always hand in hand. So typically at this point about 1 to 2 classes per semester in our foundational courses may be held in an online environment. But again, very quickly you're coming back to the face-to-face instruction. And we do that when we think that whatever needs to be learned is going to be learned better by the online experience. We are also introducing, we've done over the past year, standardized patient simulations. So those of you who are new to nursing, have recently gotten your bachelor's degree will recognize that patient simulation with mannequins is sort of state-of-the-art. At the graduate level, it doesn't work so well on mannequins, so what we need to do is have professional actors who come and act like patients for us. So we've started integrating that into our curriculum as well, and what that does is that supports your clinical experience, where we have somebody coming in who particularly we can design a case study, but it will feel real to you because you as a student will be asking that standardized patient questions just like you would in a clinical environment. You'll be able to come up with your differential diagnosis and your plan of care, but you'll be doing that in that that in the safety of our lab. So we're continuing to build on that because we believe that that's going to allow students to learn best here and take better advantage of the clinical environment when you get to it. So some other resources I think for you to consider, just you are getting a master's degree, you're coming back to school, and so there is a full school environment here. So, you know, we have recreational facilities. I've had graduate students who I was so impressed with them. We would finish class at 10 of 9 at night, and they would go to the gym and take a class. We have a full library. It's beautiful. And we have a dedicated librarian to nursing, so we have good supports within the library. We have a fantastic interlibrary loan system, which is largely electronic. So for those of you who, it's been a while since you've been at school, no longer do you have to pound into the library to get your articles. This is all online, and when you can't find something through a search engine that you need, fill out an interlibrary loan, and electronically it's going to be in your inbox within a few days to a week. We also have a computer lab within our School of Nursing building so that you don't have to necessarily lug your laptop. If you're going to be on campus a little bit extra, computers are available on campus as well. That also allows us to do some online activities while we're on campus together. So we do that as well. So that gives you a little bit of an idea of what the master's programs here look like, what going back to graduate school is going to mean for you. I think most importantly is going to be your questions. So I'm going to turn it, it's just a picture of our nursing sim lab where we use graduate and undergraduate students together. And I am going to turn it back to Lisa, who can talk about application and other items like that.
Okay, Connie, thank you so much. That was a lot of information, and it was great information. I see a few questions coming in, but I'm going to go through my presentation briefly, and then we're going to go to the Q&A session. So if you do have additional questions, definitely start writing those in now. Okay, so the graduate admissions application process. You are applying to grad school. It is a full application. There are a number of things that you need to submit. But first of all, you want to go to our website, which is just graduate.tcnj.edu, and you'll see our comprehensive website. We have information about admissions, applying, our graduate assistantships, but on the right-hand side there, you see that little box that says apply now. When you click into that, you're actually clicking into our online application. So that's where you would go to obtain our online application, as well as all the information we provide about our programs, about our admissions process, about other opportunities for graduate students. So when you do have a chance, please go visit our website. We have a wealth of information available to you there. And then, as Dr. Kartos was saying, under resources, we have our graduate bulletin, our graduate column, so there's a lot of additional information under that resources section. So there's two types of application to graduate study. You can apply for matriculation, or you can apply for non-matriculation. So the differences in those descriptions. Matriculation means that you're actually applying to a degree or certificate program with the intention of completing that degree or certificate program. Non-matriculation, on the other hand, are for applicants who wish to either pursue graduate studies for professional development, or in some cases, maybe you've missed a deadline for matriculation, you want to at least get a course under your belt, you'll apply for non-matriculation first, and then try to continue on to apply for matriculation into one of our programs. And for some people, they might just want to see if the program works for them, and they'll just take a class first as a non-matriculated student. So non-matriculation is essentially a visiting status, where matriculation, you're committing to applying to the degree or certificate program you're interested in. So for matriculation, applicants must have either a bachelor's degree or a master's degree where it's applicable. So obviously for our postmaster's programs, you would need to already hold a master's degree. We do look for degrees from accredited institutions in the U.S. or proof of equivalent preparation from a foreign university. So essentially, if you did go to school outside of the U.S., there are agencies that essentially review your credentials and then inform us here at the college if your degree is equivalent to a U.S. degree. And we do look for a minimum GPA of 3.0 for matriculation. For non-matriculated students, you do need a bachelor's degree. At that point, you're not saying that you're interested necessarily in a postmaster's program, so we're not looking for a master's degree at that point. You need a 2.75 cumulative or a 3.0 in your major to apply for non-matriculation. And again, we need to see proof of your degree from a U.S. institution or the equivalent. One important thing to note for non-matriculation is students who are non-matriculated are not eligible for financial aid. So if that is something that is important to you, you'll want to come into a degree or certificate program as a matriculated student. The other thing to realize is that because non-matriculation is a visiting status, priority goes to students who are in one of the degree or certificate programs. So if a course is getting to capacity, the matriculated students are going to get first choice at those seats. So what do you need to submit? For matriculation, it's a more broad application. We ask for a lot more information. So we're asking for that online application to Graduate Studies, which you get off the graduate website. There is a $75 application fee. And for anybody who has previously attended TCNJ, either at the undergraduate or graduate level, that fee is waived. We don't ask alumni to pay that fee. We ask for a resume, a student essay, 2 letters of recommendation, official transcripts, and again, if you have a master's degree, we want to see both undergraduate and graduate transcripts, or if you went to school outside of the U.S., we just need to see that equivalency documentation. And then, as Dr. Kartos mentioned, we do sometimes ask for GRE scores. Our waiver policy is on our website, but essentially, as she said, we do look for a 3.2 GPA in the undergraduate degree. Anybody who has a 3.2, we will generally waive the GRE for you. If you were a TCNJ undergraduate student, we actually look for a 3.0. So we do give a little bit of wiggle room for our alumni. Generally because we know the quality of the nursing program from which they came, as it's our program. So 3.2 if you went to a school other than TCNJ, 3.0 if you were a TCNJ alumni. That's the GPA that you need to have the GRE waived. If you hold a master's level degree, we waive it as well. For non-matriculation, again, you need that online application along with the $75 application fee. The same waiver applies. And then we just actually ask for a resume, a student essay, and the official transcripts. So we're not asking for those additional documentation. We're not asking for test scores. We're not asking for letters of recommendation, etc. And again, that's because this is a visiting student status. If you do apply for non-matriculation and are accepted for non-matriculation and then make the decision that you do in fact want to enter one of our degree or certificate programs, it is important to note that it is not automatic. You still do need to apply, which means you need to submit a new application for matriculation and then submit the additional documentation that require for matriculation. So that is something important to note. It's not a guaranteed movement from non-matric to matriculation. So as I said, the online application is available on our website, which is graduate.tcnj.edu. If you click on the apply option on our website, it'll take you to the application as well as to a list of the required supplemental documents. And then we do allow some documentation to be submitted online along with the application. So you can choose to pay your fee online, and then anything that you're creating yourself. So your resume, your personal statement, anything that's coming from you can be attached either through a Word document or a PDF document to our application. Anything that's coming from an outside source, GRE scores, letters of recommendation, official transcripts, those do need to come in hard copy. You can't attach those to your application. But anything that you're generating yourself can be attached, and that just makes it a little easier, a little less that you have to send by mail. The list of supplemental documents, I went over those. That's the essay, resume, letters of recommendation, etc. But if you ever needed to go back, you can go to our website, and we actually list the documents that are required by program. So you would just find the nursing program that you're interested in, click on it, and you would see the documents that you need for that program. Included in that are forms that we ask you to have your recommenders fill out. If you're applying for matriculation and need that letter of recommendation, along with that letter we ask that a form be filled out. And again, that's available on our website. So it's important to note that the graduate office does collect all this information, all your supplemental documents, and then once your application is complete, it goes under review. And our office does need all the pieces to be there for us to consider the application complete. It will not go under review if it's not complete. So again, that's the online application, the fee if it's required, all the supplemental documents, and GRE scores if those are required. Once we have that all together, then your application goes under review. And our deadlines are important to note. We do have what we call admission periods. So for example, fall 2015 for matriculation. We allow students who are applying to all the nursing programs, the MSN programs, the postmaster programs, and any certificate programs can apply for fall admission. The priority deadline was February 1st, and then the final deadline is August 1st. So that's a pretty significant chunk of time. In that chunk of time, we review applications on a rolling basis. So essentially, if a student was to apply by February 1st, they would be put under our priority deadline, which means your application is reviewed right away, and if you're admissible, you'll get a decision letter giving you the opportunity to accept admission at TCNJ. From there, applications are reviewed on a rolling basis until the final deadline of August 1st or until our program reaches capacity. So if a program fills before the final deadline, we will stop reviewing applications at that time. And again, it's just important to know that our MSN programs do require a fall start and an application for fall. For spring, our deadlines are October 1st, which is the priority, and then the final deadline is December 1st. So again, same thing, October 1st, anything that's complete, on file, ready for review, we'll get a first look. Anything that comes in after October 1st is on a rolling basis until the final deadline or until the program reaches capacity. And again, for spring, we're looking at our postmasters and certificate programs only. For non-matriculation, the deadlines are actually a little shorter. For fall, it's August 1st through August 15th, and for spring, it's December 1st through January 7th. And from year to year, these dates don't change. It's always August 1st If that happens to be a Sunday, that's still the deadline. It just helps us keep our deadlines consistent from year to year. And then lastly, I just want to mention an opportunity that graduate students do have here on campus to obtain a graduate assistantship. So a graduate assistantship is a position on campus that eligible graduate students can apply to. Openings are limited, and students do need to submit an online application as well as a resume. But if a student is hired, they're hired to work in an office on campus. And along with that position, students would have to work 15 hours a week during the fall and spring semester. So the contracts are yearly contracts. You're contracted to work in both the fall and spring, and it would be 15 hours a week while college is in session. And the compensation for that is a tuition waiver of $5,000 per semester. So over the course of that academic year, it's $10,000 in tuition waiver for the student. To be eligible, students must be full-time. That means they need to be taking at least 3 courses, so 9 credits of coursework. They have to be matriculated. They can't come in as a non-matriculated student and apply for a graduate assistantship. And you have to have at least a 3.0 GPA. And again, graduate assistants are hired for the full academic year. Students can have a graduate assistantship for a maximum of 2 years. We passed the deadline for this coming year for graduate assistantships, but the deadline is April 15th of each year, and the application is on our website. So if somebody is looking for, potentially coming into TCNJ next year, you just want to make sure you submit that graduate assistantship application by the 15th, if that's something that you're interested in. And that's all I have for the admissions process. If you have any questions about the admissions process, you can always reach out to us. Our email is just graduate@tcnj.edu. Our phone number is listed there. And our office, anybody in our office can answer questions related to the application process. So we'd be happy to hear from you. Just give you a second to take a screenshot of that if you want to. And now we're going to go to our Q&A session. So I'm just going to open that up for Dr. Kartos. Connie, I'm not sure if you wanted to go to your webcam now.
I am. No one gets scared. So I'm showing that people are seeing me, so hopefully everyone can.
I do see you.
Good.
Okay, so we did have some questions coming in, but if you wanted to say anything first, go ahead.
Yeah, a couple of just things while people are thinking of questions. One thing I just want to say about recommendations, please remember for us what we are looking for is your ability and potential to be a leader in nursing. A master's degree in nursing is a leadership role in nursing. Only 10%, maybe more of nurses hold a master's degree. It's a leadership position. So we're looking for your ability to lead other nurses. And we believe that nurses know best what other nurses are capable of. So although we're happy to have physician recommendations, if that's who you work with and you think they can speak to your ability to succeed at a graduate level, what we really love to see is a nursing recommendation. Physicians tend to write a recommendation that says, oh, they're really smart, and they're nice, and that's great. But we're looking for somebody who has a degree higher than your degree, so not a baccalaureate prepared nurse, but somebody with a master's or a doctorate who looks at you and can say, yes, I want you to have this advanced degree in nursing. I see you as a nursing leader. So those are the people who, we really want to hear from as far as recommendations. I mean, certainly anybody is okay, but that's what we're really looking for there. The other thing that I just wanted to talk about funding-wise, there are a wide variety of scholarship opportunities. For example, the Executive Women of New Jersey is offering some scholarships for women pursuing graduate study at TCNJ. And occasionally for full-time students, we do have federal grantee traineeship money. So if you're looking to be a full-time student, there are some other in addition to the graduate traineeship money that Lisa mentioned. And Lisa, do you want to read those questions to me? Is that how you want to do it?
Yep, that's what I can do. I can just field the questions for you. So just following up with what you just said about letters of recommendation, would it be appropriate to obtain letters of recommendation from nurse educators, either from a bachelor's program or an RN program?
Absolutely, that's perfect as well. Those people know that you have the intellectual capability to handle master's education. It's rigorous, so those are perfect people as well.
Okay, thank you. And then just a question on the essay or personal statement, if you can speak a little bit about what the review committee would be looking for.
Yeah, they were really looking for, why do you want to do this? This is a commitment of time and energy. What is it that you hope to do with this master's degree? Why? A personal story is fine. It doesn't have to be some amazing undergraduate admissions essay that blows our socks off, but we really just want to know, why is it that you want to do this? If you want to be a clinical nurse leader, what is it that's motivating you to do that? For those folks, we're looking for somebody who says, hey, I'm really interested in driving down the cost of healthcare and improving evidence base, and I see other clinical, many times in those essays we see that they have a colleague that they're so inspired by. That's the kind of thing we're looking for. What is it that you want to do if you want to be a nurse practitioner? How do you want to be taking care of people? What do you want to do with this degree? So it's very personalized. For our school nurses, it can be very simple. You can be telling us, look, I've done critical care, I've done ER, I've taken care of pediatrics, and I just want to settle in a school system because I really feel like I have a lot to offer there. It doesn't have to be anything huge, but we're looking for sort of the inside of you. What's the motivating piece here? Because really we get concerned when people can't clearly articulate what the reason they're coming for is. A master's degree is not a horrible journey, but it is a journey that will require some energy on your part. And so we need to see what the internal motivation is. That helps us be reassured that you're going to succeed.
Okay, thank you. And then there was a question about just distinguishing part-time versus full-time, and if that's something that you're locked into during the duration of your program, or if that's something that you can move back and forth between.
Yeah, that's a great question. So we have students all the time who shift between part and full-time. The only problem that happens there is, we have a nice plan laid out as far as you take 2 classes, 2 classes, 2 classes, 2 classes, part-time, and you're done in 3 years. So when you go from part-time to full-time or vice versa, it changes the amount of time that it takes for you to finish. But we do have students who start part-time and say, you know what, I just need to get out of here. That's going to be able to give me some grant funding, or that's going to get me traineeship money. I just want to get it done. We also have students, and then, we might not be able to get you out in 2 years straight, but we'll do our best. Sometimes we have students who start full-time. We've had some students in this past year who were straight out of a bachelor's degree, and they really didn't have a position lined up for themselves, so they said, I know I want to go back to graduate school, I'm just going to keep going, and they found clinical jobs in the middle of the semester, and they dropped down to part-time status. That's fine. Lisa didn't mention it, but you do have 6 years to complete your degree. So we have people who take leaves of absence for getting married, having families. You got 6 years. So there's a lot of fluidity there. So part-time is typically 2 classes a semester. Full-time is typically 3. Sometimes we have people who really need to slow it down, and so they'll do 1 class a semester. The time that gets a little tricky is when you hit, for nurse practitioner students, when you hit the clinical courses. um, that those courses are not just one class credit. They're worth sort of 1.5 classes because you're in clinical and you're taking a class in the evening. It's hard to do that as just one class per semester. But we have some students who've extended their program to the extent that that's like 1.5 classes, and that's certainly okay. There's not one right way to get through.
Okay, great. And I do see one more question here. It may be our last question, unless anybody gets anything else in. If you have any other questions, please write them in now. But we only have a few minutes, so this might end us off well. Can you mention some of the clinical placement sites that TCNJ uses?
Sure. So we use different sites depending on what program you're in. For school nurses, we're going to find a clinical placement for you in a school nurse program based on your interest, whether that's inner city, whether that's suburban, whether that's more of an urban setting. Where do you think you want to be working? Where do you want to build your expertise? We'll try to find a site for you. Tracy Perrin, one of our faculty members, has deep connections in the school nurse community. We can probably find a place for you depending on your interest. For our nurse practitioner students, sometimes we use low-income clinics because they're great learning settings. So Capital Health Family Practice Clinic, Henry J. Austin, clinics at New Brunswick. We have placements. We do require students to be within an hour and 15 minutes of campus because we will send out faculty site visitors, and we don't travel all over the country, so unless there's an extenuating circumstance, we like it within that hour and 15 minutes. We do primary care offices, some private practices. We use our own student health sometimes for clinical sites, and again, sometimes nursing homes make great learning environments, particularly for our adult gerontology students. They need a nursing home rotation. And sometimes it's just a regular, wherever your healthcare provider is, sometimes they'll take you on as a student. So it really varies. And we try to get students a wide variety of experience so that they've had some low income, some suburban, some inner city, some hospital, some clinic, a variety of different experiences so that you can market yourself as being very broad.
Okay. And I did see one other question come in. I think we have a minute for it. Any possibility TCNJ will open an administrative nursing leadership master's program in the future?
Great question. So we are working on trying to figure out how to do that best with our existing programs. That program isn't going to be ready for this coming fall. I hope we will have something that looks something like that coming soon, but I can't tell you what it's going to look like. Again, if the person asking that question is interested, one thing to do when you're anxious to get going and you're thinking, wow, I want to go to TCNJ, but they don't quite have what I want, one thing to do is to apply for non-matriculated status and take some of the core courses. So start in the fall, take advanced pathophysiology. Almost any program in the country that has a master's degree will require that course, and most programs will accept 6 to 9 transfer credits. So that it's a 3-credit course. You could start with that. You're definitely getting underway, and then hopefully by the time the fall rolls around, we've rolled out what we're going to be doing. We're looking at that, and we just haven't had full enough conversations for me to speak to it, but that's an option, is to just start as a non-matriculated student here and get your core done.
Okay, well, great. That sounds like something exciting that's coming up. Well, that looks like it's all the questions that were asked by the attendees. Perfect timing. We're hitting 5:29. So I just want to say thank you to everyone for participating tonight. We really enjoy having this time to spend with you in this convenient way, where you can be at home and we can answer the questions that you have without getting you to come out here to the college just yet. But again, we do hope that at some point you do contact us or even come for a visit. Although we don't have organized tours for graduate students. If you get in touch with the graduate office or with the nursing department, we're always happy to walk you around, show you the facilities. So please definitely reach out to us if you have any other questions or if you're interested in visiting campus. I'll let Dr. Kartos say her goodbye, and then we'll leave you for this evening.
Thanks, Lisa. Again, I want to thank all of you for joining the webinar. I think it certainly, even if you've decided, nope, not ready, hopefully we've got some ideas started with you. I am more than happy to answer questions. Email is the best way to find me, and then generally I will get back to you within 24, if not 48 hours. But please reach out with email questions if you have concerns about the application or what needs to be in there. And again, as Lisa said, sometimes non-matriculated is the way to go. So don't be afraid of that either, and we hope that we'll see you soon on campus. Thank you so much.
All right, thanks. Okay, I've dismissed everyone. So it is just us.